declare open this hearing of the Public Accounts and Estimates Committee. I ask that mobile telephones please be turned to silent. I begin by acknowledging the traditional Aboriginal owners of the land on which we are meeting, the lands of the Wurundjeri people. We pay our respects to them, their elders past, present and emerging, as well as elders from other communities who may be here with us today. On behalf of the Parliament, the committee is conducting this inquiry into the 2025-26 budget estimates. The committee's aim is to scrutinise public administration and finance to improve outcomes for the Victorian community.
Minister, are you aware of any state-funded hospitals that don't provide surgical abortions?
Thank you very much for the question, Mr. Puglielli. So in my time as Minister, I have worked very hard to increase access to both surgical and medical termination of pregnancy, and it is my expectation that these services are available in our public health system. But I might say that in some there will be cases where the workforce is not available to deliver, say, surgical termination, but it's certainly my expectation that there is a referral pathway in place. And so only a couple of months ago I hosted, or the department hosted, and I was a speaker there with Professor Wayner, who joins me today, an abortion symposium. Now, we held that symposium because we wanted to share knowledge and best practice across the system, and frankly, the work that I've been trying to do is to make sure that abortion services, that abortion care is seen as healthcare in our public healthcare system. And so, once again, really normalising women's healthcare. But in terms of, and we do know, because of the work that Women's Health Victoria have done, that there are areas where it is more difficult to access an abortion than it should be. But I'm committed to doing a range of things in order to address that, including the sexual and reproductive health hubs, the women's health clinics, and the removal of the formulary that applied to registered midwives. So registered midwives used to have a list of medicines that they were able to prescribe, and MS2 step was not one of those. I've now removed the formulary, which means that they are able to prescribe to their full scope of practice, which includes MS2 step. So I think what we'll see over time is that there'll be a greater take-up of medical abortion. Of course, that is easy, more readily and easy to able to deliver and support women to access that service. But it is true that there are still some workforce challenges when it comes to access to surgical termination.
Can I ask, are state-funded hospitals required to report to the department regarding their provision of surgical abortion specifically?
It is my expectation, as I said, that our public health services offer a full suite of health services to Victorians, but recognising, of course, that not every hospital can deliver every service because you require the workforce in order to deliver that. And for me, the most important thing is to ensure that I've got that spread right around the state. And I can tell you that here in Victoria, 23 of our health services provide access to surgical termination.
Okay. You mentioned some specific instances where there, for example, were workforce challenges. Are you able to provide the committee with a list of hospitals that aren't providing surgical abortion? The only point that I would make in relation to that is that this may fluctuate based on the availability of healthcare workers. So it's not a set in time. It's not a set in time piece. But I could also perhaps preempt where you might want to go on some of this, Mr. Puglielli, but we do also maintain here in Victoria a capacity for conscientious objection to the delivery of abortion services. So individual health care workers may not want to deliver those services, and we don't make them do that. However, it's certainly my expectation, and indeed I think it's a requirement that that women and girls seeking access to abortion care are referred
to a person, an alternative service where they'll be able to get the care. But Mr Puglielli, I think the biggest challenge still remains in the regions. That's why access to medical abortion is so important, because it is much easier, to get the workforce, if you like, but also I know the abortion symposium was also about, as I said, growing this kind of this community of practice, making sure that that clinicians who deliver abortion services are connected to one another. And really, we want to strive here in Victoria to be one of the best when it comes to, the best when it comes to delivering all of the health services that Victorian women and girls need and deserve.
Thank you. Just moving on, last year the government abolished the Victorian Assisted Reproductive Treatment Authority, VARTA. Can I ask, since VARTA was abolished, how many FTE staff have been appointed within Department of Health to undertake its regulatory functions specifically for IVF and assisted reproductive treatments?
Okay, so thank you for that question. So, look, the government was really committed to ensuring that we've got a strong, safe assisted reproductive treatment sector, and one that Victorians can have confidence and faith in. And the health, welfare and wellbeing of Victorians born as a result of treatment procedures is always paramount to us. That's why our government has delivered a range of reforms to strengthen and modernise ART regulation and ensure that donor-conceived people can access the information they need in a supportive way. And as I'm sure you would also recognise, Mr Puglielli, a lot has changed since VARTA was first set up. And indeed, assisted reproductive treatment and access to fertility care is now a normal part of so many people's journey to start or grow a family, and indeed part of the health care that we look to provide. So to support the successful transition of the donor registers, we've worked carefully to transition sensitive data and establish the services and supports that Victorians need. So it's a highly complex and consequential piece of work that's supporting Victorians for decades to come, and we're working to make sure that we get it right.
Can I ask in relation to we're 5 years into the 10-year action plan to prevent oral disease. Just looking at the 4 quantitative goals in that plan, can you provide us an update on our progress towards increasing the proportion of children entering primary school without dental cavities to 85% from a baseline of 64%?
In terms of our dental program, I can outline to you that this year's budget is investing $218.3 million into our dental services to provide public dental care to 332,150 eligible Victorians, and that this program provides public dental care for all children 0 to 12, young people aged 13 to 17, adults with healthcare and pension and concession cards, and all at-sea people. As the Deputy Secretary has pointed out, we're going to meet our performance targets for this financial year in relation to our public dental health program, and I can also report that wait times have decreased.
Have any upgrades been made to address mobile data and IT system issues for paramedics in regional and rural Victoria?
So certainly we're rolling out those radios as we speak. So there are 700 vehicles that will be upgraded across regional Victoria, in addition to 1,800 portable radios that will be upgraded through that program. That work has commenced in Barwon South West, and that has almost completed as it rolls across to the Grampians region. And the work is expected to be completed by June of 2026. In addition to the confidentiality outlines that Mr Crisp has outlined, it also improves our paramedic safety and improves our duress functionality. So it improves our safety of our people out in the field, which is critically important, and that work is well underway and will be delivered by June 2026, in addition to the iPads that have now been rolled out right across the state to more than 5,000 frontline staff, and they're now rolling out to our first responders as well.
Thank you. Can I ask, are there any plans to support access to mobile data terminals for rural paramedics?
Yes, so there is. So the intent is with the iPad functionality that in future stages that we'll be able to use the iPad with some intent to be able to use the mobile data terminal, which gives our paramedics better understanding and better information around the scene safety, around any patient particular clinical needs, and that's intended in future rollouts.
Can I ask, as a result of NDIS changes, are there any instances you can point to where this portfolio has been required to provide disability services that were previously provided by the NDIS?
Specifically, not as yet, but I mean, there's obviously the services, as I just spoke to, that we provide for those who are not eligible for, who don't have an NDIS plan. And I think, one of the remarkable things about Victoria is we have successfully managed to keep some of our disability infrastructure in place in a way that I think, again, is the envy of other states as we embark on this journey of following the NDIS review and in the establishment of foundational supports as we agree them and design them. And also because they are complemented by our universal systems of education and health, we do have other services that both disability specific but also, I guess, a more, as I like to describe it, a business as usual approach to inclusion. That means that we are providing for people with disabilities in other ways through our work in schools and our health system and whatnot. But for people who were previously NDIS participants who, as a result of changes to the scheme, we're not quite there yet. So we are in this process of agreeing foundational supports, designing foundational supports for that cohort of 0 to 9. And so we will absolutely be there in the not too distant future, but not yet over and above what we already have as non-NDIS specific supports, if that answers your question.
Yeah, and in terms of the not too distant future, is there a timeline you can prescribe to that? How far into the future are we talking?
So initially there was the discussion around the 1st of July of this year, and the Commonwealth have now agreed that that is not achievable because their legislation took much longer to get through Parliament than they originally anticipated, and the design work for foundation, the agreement about what foundational supports are and the design work for them is really a live conversation. As I indicated before, we had a Disability Reform Ministers' Council meeting in Adelaide on Friday with the new ministers Butler and McAllister. This is obviously also linked to the National Cabinet discussions and the health agreement as well. So there's further work to go on that, but I would imagine that, I mean, and it's concurrent, if you like, but also until there's an overarching agreement at the National Cabinet level, it is difficult to really define in a disability sense what that will be.
Okay, thank you. On disability programs and services in this budget, is there anything dedicated to prenatal care and support for parents who receive a diagnosis their child has Down syndrome?
There's not something specific in this budget for families with Down syndrome, but there are a multitude of other ways in which we're supporting them.
Genius Childcare is now in the hands of administrators, having run 7 centres in Melbourne. I understand the Altona one is already closed and the fate of the rest is still up in the air while the administrators try to sell them. Can I ask, given widespread complaints that staff were not getting paid, that there was legal action by the company's creditors to the tune of millions of dollars, why was Genius and its owner, Mr. Darren Mosqueda, allowed to continue trading?
At the outset, I just want to make the point that childcare, and certainly when it comes to things like insolvency employment matters, falls within the Commonwealth jurisdiction. So obviously we have a role in regulation at some level, but insolvency and employment matters are obviously a Commonwealth jurisdiction. That said, and I did want to acknowledge the announcement of Genius that they plan to require staff to, that there was an issue in relation to the payment of staff with Genius. Failure to pay wages or rental are not in and of themselves, so offences under the national law, which as a regulator we have responsibility for. But I would say that our government is keen to continue to work with the Commonwealth and other states and territories to look at the adequacy of national law and regulations when it comes to that. And just last week I had a conversation about that with the new federal minister, and I also pointed out to her that it was a matter that a number of us want to have a conversation with her about at our upcoming Education Ministers meeting as well.
There have been some pretty shocking allegations of serious misconduct and systemic issues across multiple affinity education group centres, so that's in New South Wales and ACT. This group, I understand, also operates childcare centres in Victoria. Minister, have you received advice on the compliance of affinity centres in Victoria?
So Affinity Education operates 52 services across Victoria, to your point. Where there's current investigations, it would be inappropriate for me to comment on those. Victoria's regulatory authority and other regulatory authorities are actively monitoring those affinity education services and investigating incidents in services, and will take action where that is required. But as I said, I can't comment on any ongoing investigations. However, if we have concerns that issues have occurred, such as they have been seen to occur in other states, then investigation action would obviously follow that. The allegations that you're referring to have not been, so far, ones that have required action in our jurisdiction, but where there are ongoing investigations.
Looking at early childhood sector supports and regulation funding for 2025-26, 15.4 million has been allocated in this year's budget, to my understanding. Can I get a clarification of what proportion of that funding is specifically allocated to strengthening participation of children from culturally and linguistically diverse backgrounds in early childhood education?
I mean, one of the critical things in this budget is our investment in equal participation in early education. And the Victorian Government has invested $16.3 million over 4 years, $2.4 million ongoing, to provide early intervention programs supporting children who are at risk of poor educational outcomes, which obviously can include those who are of a non-English speaking background. There's ongoing funding for the Access to Early Learning program at 6 sites. There's flexible support packages for children with complex trauma, which are often also children of non-English speaking backgrounds, be they children who have come here with trauma experiences, and who might present with learning and developmental needs that impact their inclusion and their full participation in kinder. We've also got the Fall Lookout streamlining access officers to build system capacity, which is more about supporting children in the child protection system. And we've also got the package at the Children's Hospital.
I declare this hearing adjourned.